I'm Isabel Steele. I live in Benbecula and I work for the Health Promotion Department of the Western Isles Health Board. And my job could be writing policies and strategy that affect young children and young people, and providing training on issues such as child protection, children's rights, bullying, other mental health issues, general health and wellbeing issues. About 5 years ago, we were doing a piece of work with the schools on bullying and with a company from Edinburgh. We used them as professionals on the issue of bullying. And as part of that work, we got the chance of being one of the first Children's Parliament in Scotland. The Task Training Agency, which was Cathy and Colin, were also setting up the Children's Parliament group. And they had seen the work we were doing here with young people, and they thought it would be a really good opportunity for us and for them to have a Children's Parliament group in Euston Barra. Initially, the Children's Parliament I got involved with and felt we should go for it because it was building on children's confidence, building children's self-esteem, which is sort of always at the heart of health promotion work that we do. And also at the same time, we as a health service, we were being asked to consult with young people about how they found services. So although we didn't have a firm idea exactly how we were going to develop and deliver the programme, it was very much about, will we make young people more confident in being able to consult with them later on, so that they can tell us what they think about our services, was always at the back of my mind. And how we were going to do that, we weren't really quite sure. But we're going to work with children of all abilities because I felt, and asked Cathy and Colin did as well, that all children have a lot to give. But quite often when it goes to consulting with them, it's the most academic and the best behaved children and everything that get the opportunity to have their say. And we wanted a mix, we wanted a more diverse group if possible, to sort of work with them and see if we could make a difference in their lives and their confidence levels, their self-esteem. And at the end result for me as a health worker was that we'd be able to consult with them. Yeah, the Children's Parliament work is based very much on the themes from the UN Convention on the Rights of the Child. And a lot of the work we're doing was based on children's rights and increasing children's knowledge about their rights, but also increasing adults' knowledge about children's rights, so that you had a two-way thing. So a lot of the programme was based upon, the new programme was based upon these themes to try and get the children realising what their rights were and how they could use these rights. And also we did some work with adults to make them realise that children had rights and that they could actually get some really good work out of children by letting them have their rights. When we went to Haishka, the children were actually working on the John Muir Award. So it was part of something that they had been working on for 3 or 4 months. And it let the kids stick at something. We supported those children maybe who had more chaotic lifestyles to actually keep at something, which is quite difficult for some of them to do sometimes, because if they're not getting any support in areas where children would normally get it, to carry on with something, or encouragement from somewhere to carry on with something, they can quite easily give up. So we supported them over that 3 or 4 months to maintain the interest. So they were working towards achieving something, and that sense of achievement is great for children's self-esteem and confidence. So they had to plan the event, going on the boats for the first time, camping for the first time, some of them. And they had to organise the food, everything they would need to survive on a desert island, basically, as well as looking at what had happened in their communities before them. So they actually went to see where people had lived and gone to school in, and they met Angus Moy, who'd lived there, they were really fascinated by. So they were learning about their history and their culture as well. So they had more of a sense of belonging to where they're from and things. There's a whole load of experiences that teamwork, everything like that was kind of in there that they were doing when they went to Haishka. Well, certainly met our aims. And the children I feel, have achieved so much, and they've had so many new experiences. And I don't believe that they've worked through creative art and play so much, in any other project they might be involved in. And it was only one day a month for 10 months of the year. There was Christmas and summer holidays that we didn't meet. But just to see that the input they got for one day a month was actually, there was changing them, I feel. Yes, they're changing anyway as children, but I felt that there was changing them in their confidence, in their interest, and they came back time and time again. Overall, I think the children's confidence levels and communications with adults, positive communications with adults, and positive experience with adults they've really benefited from that. They've engaged with adults I believe they wouldn't have engaged with otherwise if they hadn't been involved in the Children's Parliament. They've had loads of opportunities from, going to camp in Highshire, which is very expensive actually. It was the most expensive thing we did by the time we hired the boat and everything. Or going to interview Kathleen Marshall, Scotland's Commissioner for Children and Young People, interviewing her staff before they were put into their jobs. So they've done a whole level of stuff. And I just think they've benefited so much from it. And I can see them putting that back into their communities and hopefully get a real sense of community belonging themselves. I feel that we're leaving it far too late before we ask them their views on anything. And by that point, they're uninhibited by adolescence and you get less from them. Whereas I've certainly seen them developing that the earlier you started and continue that consultation process right through, they have faith in it. Whereas the experience I'd had previously was that we were consulting with 14, 15-year-olds and they didn't feel that what they were saying was actually going to make any difference. Whereas the consulting that we've done with the Children's Parliament, I feel the children believe that their views are actually taken into consideration the way that it's done. They actually feel that, well, my knowledge is gone somewhere, my view on something's gone somewhere, and I am going to be part of the big picture. Whereas I didn't get that feeling when we did consulting with 15, 16-year-olds in the past.